My job at the CDC is to prepare the U.S. public health infrastructure or public health departments to be able to address the health challenges of climate change, which will be the main theme of my talk. The extreme magnitude of storms, especially heat waves, has had a tremendous toll on morbidity or illness and death. In 2003, Europe experienced an unprecedented heat wave that lasted for over 2 weeks that accounted for over 70,000 excess deaths. A few years later in Russia, they had another large heat wave. And these heat waves are large, but they're found in areas that typically don't experience them, so they're not prepared for them. And Russia experienced 50,000 deaths in an 8-day period as a result of that heat wave. Very large impacts on health. But also we're seeing small-scale impacts that can be magnified over time. Shifts in allergies, for example, through longer growing seasons, longer pollen seasons, more intense pollen seasons because of carbon dioxide fertilization of plants, leads to dramatic increases in pediatric asthma across the country. Our way of managing these health threats now and being able to predict them into the future is done through a process of adaptive management, where we continuously assess, project the potential for diseases emerging or spreading into new areas, put systems in place to detect those changes in disease patterns, and then put in interventions to protect the public's health from them. It requires constant monitoring, adaptation, and building the skill set to be able to engage not only climate science with health, but also with the intervention science to protect people and monitor what exactly works and what doesn't work when addressing climate change.